Affordable Care Act analysis. Title II, Role of Public Programs, regarding Subtitle A, Improve Access to Medicaid, by Emily Gibson, Kimberly Holloway, Lianna Melvin, Natasha Radic, and Lauren Riley. The intent of our analysis is to provide a summation of Subtitle A regarding improved access to Medicaid, explain how improved access to Medicaid will potentially improve the overall outcome of healthcare, present favorable points regarding Subtitle A of the Affordable Care Act, present points of opposition regarding the Act, and to provide justification on whether Subtitle A will remain or change with the evolution of the Affordable Care Act. One thing we must ask ourselves is, why is Subtitle A significant to the overall success of the Affordable Care Act? This subtitle provides eligibility, benefits, and increased federal assistance for low-income populations requiring Medicaid coverage. It also provides coverage for non-elderly using a modified gross income format. It offers premium assistance for employer-sponsored insurance. It covers former foster care children. And Section 211 under Title II will significantly impact the treatment of the political subdivision provision regarding an increase in the federal medical assistance percentage, which is used for major disasters in the United States. So, what exactly is known of the context of current knowledge? A study conducted in 2013 by Commonwealth Fund Health Insurance revealed that nearly 70% of Americans support making Medicaid available to more people in their states, while only 21% oppose the idea. These findings collaborate with the grassroots efforts to American citizens from all walks of socioeconomical spectrums. Also, we realize that again, Medicaid will be expanded to include all persons under the age of 65, specifically targeting those in rural areas and from low-income populations. Medicaid eligibility will be based on gross income, and the federal government promises to fund 100% of the cost to newly eligible clients. Finally, it is important that payments from primary care professionals will be covered as well, including those who are in rural populations, by 100% coverage. Why is Subtitle A relevant to the success of the Affordable Care Act? This plan provides eligibility to more individuals, including all non-elderly, non-pregnant individuals who are rightfully entitled to Medicaid coverage. Also, the federal government plans to match payments to both patients and providers over time. The government will support states by providing 100% coverage to those who are newly eligible in 2014, and in 2016 it will decrease to 95%, leading all the way up to 2019 where it will be matched by 90%. Expansion and role of public programs such as Medicaid provides quality and affordable health care insurance to all those that may need it.
With the Affordable Care Act being so extensive, it is important to fully understand each subtitle. Subtitle A potentially improves healthcare by making improvements to Medicaid. The Affordable Care Act focuses on two different legislations to improve health: the Patient Protection and Affordable Care Act and the Healthcare Education Reconciliation Act of 2010. Provisions on both of these acts have led to the improvement on medical services and expansion of Medicaid coverage to millions of low-income Americans. There were several provisions made in these two legislations that are related to Medicaid: eligibility, financing, information technology systems and data, coordination with affordable insurance exchanges, benefits, community-based long-term services and supports, quality of care and delivery systems, preventions, just to name a couple. Other provisions of the Affordable Care Act that is related to Medicaid is the provision of children's health insurance programs, dual eligibles, provider payments, program transparency, and program integrity.
One of the most important benefits of Affordable Care Act is that all Americans have the opportunity to be covered by Medicaid. The only exceptions are illegal immigrants and those who are exempted from the mandate. It is important to know that all those hardworking people who still live in poverty will be insured and will be able to take care of their health care needs. With Medicaid coverage, additional 32 million Americans will be insured. We are well aware that many individuals visit the emergency room when they need medical help. With Medicaid, they will be able to visit physicians of their choice and take better care of their health. Many families lost their property due to numerous medical bills. With Medicaid expansion, hopefully, that financial stress will decrease. It is important to mention $180 billion of financial gain for all participating hospitals. Hopefully, the portion of that money will be used for research to find cures for many serious diseases such as cancer, cystic fibrosis, Parkinson's disease, and Lou Gehrig disease.
Just as many promote Medicaid expansion, many are opposed. Participation is voluntary at a state level. Some of the concerns begin with the downfalls of Medicaid historically. These drawbacks include limited access to health care, which would shred the safety net for the poor, as they are forced to compete with millions more people to get care from the limited number of providers who see Medicaid patients. Patients would have a low quality of health care coverage, and providers would continue to have a low payout. Medicaid expansion addresses all of these concerns, but the opposition feels historically Medicaid has a large valley to climb out of. Many of the states are concerned with the fiscal uncertainty they will face if participating in the Medicaid expansion. Even though the federal government insists that they will be paying 100% of the costs associated with newly qualified enrollees until 2017 and gradually declining that amount to 90% by 2020, one state official admitted they couldn't afford such a surge in enrollment. The more people a state has that are eligible for Medicaid, the more it will cost the state. Medicaid spending will continue to increase as the federal matching rate decreases, which again will cost the state money, potentially taking funding away from education, transportation, parks, public safety, and other vital needs of the state. The fear of other rising costs that may not necessarily be related to Medicaid expansion, but then again would not be covered by the federal government, and also take into consideration the number of people that cancel their private insurance in order to obtain Medicaid. This may require providers to charge higher rates for the private insurers. Regardless of expanding Medicaid or not, some states will still have people that fall into the Medicaid gap. Many factors have to be in place for a person not to fall into this gap. There is not a surefire way to keep all individuals out of this gap, even with the Medicaid expansion. They will still not qualify for Medicaid, but they will also not make enough to qualify for the marketplace subsidies either. The Affordable Care Act was originally written under the assumption that all states would participate, but now that it is optional, there are real consequences for providers in states that choose to sit out. This map represents where the state stands in regards to the Medicaid expansion. There are the two obvious sides, acceptance and opposition, with a handful of states still considering expansion. Interestingly, the federal government is working with some states on creative waivers, like in Arkansas, where they have figured out how to use Medicaid dollars, but it went to the private insurance.
So the question is, will improved access to Medicaid remain or change? It is obvious that changes will have to take place if Medicaid expansion remains. There are no consequences for states who are choosing to opt out. They do not lose federal funding, and this is causing taxpayers to spend money on the states that are not participating and the people that fall through the Medicaid gap. States that are opting out are leaving millions of people uninsured. This could lead to increased spending related to more ER and hospital visits by uninsured populations. This is a major issue that will have to be addressed with this reform. With millions of new people qualifying for Medicaid, there will be an increase in demand for primary care physicians. It is already estimated that there will be a shortage of 91,000 physicians by the year 2020. This shortage will likely have a great impact on the Medicaid population, since there are so few physicians that currently accept Medicaid patients. Some changes that may improve this healthcare reform and its ability to pass are consistent participation requirements from state to state. We have pointed out the repercussions of states opting out of Medicaid expansion. Having more consistent requirements could alleviate these problems and the issue of taxpayers paying for those states who do not participate. Also, there should be increased coverage provided by nurse practitioners and physician assistants to help make up for the shortage of primary care physicians. Also, if doctor payouts are increased, then more physicians will be willing to take on Medicaid patients. There are obvious benefits to the expansion of Medicaid, but the question of whether or not states can handle the financial burden after the federal funding decreases is a definite concern and could ultimately put an end to this expansion. If the appropriate changes are made, then this reform could mean that millions of Americans are receiving affordable health care when they otherwise would be uninsured.